Community Plan by Colby, Quisenberry at Herzing University, Community Public Health Nursing, Professor Suzer Austin. In this PowerPoint, I will be discussing the community description, the people, the buildings, healthcare facilities, population. There will also be a synopsis of the community project itself and the elements involved needed to present it. Definition of a community. According to Webster, the definition of a community is one that has a group of people with similar interests that live in a specific area together. Orlando, Florida is a community of subject that I will be talking about. Orlando is a major city that is located in the center of the Florida Peninsula. This city has a diverse setting that involves communities of rural cities and urban locations. The community of Orlando, Florida is steadily growing. Per the Orlando, Florida Data USA, the population had a 0.6% year growth annually. Florida is known as many as the theme park capital of the world. These have restaurants and attractions that bring jobs and revenue to the community. There are two main hospitals that reside in the Orlando, Florida area, Advent Hospital and Orlando Health. These systems have increased the use of virtual healthcare provider visits. These visits have made self-care more convenient and have decreased the risk of spread of disease by eliminating the need of one-on-one assessments. Also, these virtual healthcare systems can increase patient attendance and compliance through the ease of making the appointments and following through. Windshield survey. The Orlando, Florida is a city located in the center of Florida. This city resides in Orange County. The community access is convenient for most. Locals have access to nearly anything that is needed for daily living. Grocery stores, restaurants, libraries, all within this community in abundance. Families also have access to elementary, middle, and high schools within reach of their specific communities. Public parks are generously scattered throughout this community, and most are safely tucked away from major roads. Many parks are very updated, and if not, are in the process of being updated. Local church groups provide many other activities besides religious services. For example, the Castleberry, Florida Community Church offers camps and state-accredited schools within its facility. The community church also gives back to the community throughout many outlets, one being events like local park cleanups. Additions and renovations to park seem to be frequently applied, and most have sports fields. Example, baseball, soccer fields, baseball courts. The parks in this community are very well kept. There are social agencies available like WIC, SSI offices, and the easiest way to reach these programs are through the City Hall building. Senior centers are scattered throughout the community as well. One senior center is located at Triplet Lake Park. They host a variety of senior activities like dance classes, card night, bingo. There is also a South Seminole Masonic Lodge at the center of Castleberry. Many restaurants are available in this county. Example, Waffle House, Chick-fil-A, Popeyes, Wendy's, Ruth Chris. The community is very well maintained and has very little debris. Community assessment. Orlando, Florida is composed of approximately 134,000 males and 146,000 females. However, married couples are in the greatest number of homeowners, ranging at 52% of residents. In 2020, the population of Orlando was at 300,000, listed by the Bureau of United States Census. According to Orlando, Florida population, the population grows at a rate of 22% yearly. Jobs in this area can also vary from engineering to hospitality. According to the Bureau of United States Census, the average median household is income $55,000, and approximately 39% of the inhabitants have their bachelor's degree. There is an approximate 16% poverty life in Orlando. Florida poverty levels for the full-time employee are at 3.7%. According to the Disease Control and Prevention in 2022, there are top 3 health issues in the Orlando, Florida community: heart disease, cancer, and general accidents. Automobile accidents are another leading cause of injury and death in the Florida community. City of Orlando is at the top 5 list in regarding to the rise of walking and riding bicycle injuries. This is due to the possibility of increased cellular phones while driving, as identified by Home City of Orlando. The diagnosis of my community plan. The community project will be hosted at Cayman Fusing and Precision Products. It's a local government contracted building that builds bomb fuses. The staff has been identified to have medical knowledge deficit that is requiring education on the why and how face mask, hand washing, and social distancing work. This knowledge deficit is evidenced by observing the improper hand washing, face mask donning and doffing, and lack of social distance. The risk of infection among line staff at Cayman Fusion is a division of Aerospace Corporation is related to a knowledge deficit regarding COVID spread. These individuals have a hard time social distancing considering the type of work they do and the need for others to help them complete it. The objective of this community project is to mitigate the spread and contraction of COVID. Goal number 1, short term, on completion of educational sessions, my goal is to have 80% of participants correctly verbalize COVID-19 mitigation techniques. Example, according to the Center of Disease Control and Prevention, in 2022, hand washing must be performed of at least 20 seconds of hand-to-hand running with soap and water. Goal number 2, short term. On completion educational session, all participants will perform return, demonstration, and verbal understanding regarding correct hand washing, social distancing, and face mask donning and doffing. My long-term goal is not measurable since I will not have an opportunity to go back to the facility for evaluation. Community partners and resources. Jessica Carey is the director of Beata Skilled Nursing Office in the Orlando, Florida area and has worked with Beata for over 8 years. This is a non-profit healthcare organization. Jessica is a graduate of Pennsylvania University, has a major in psychiatrics, has a minor in education, and is a registered nurse. Her office offers private duty skilled nursing services and educational seminars. A few of the major subjects that Jessica has lectured on is COVID-19, communication, and effective leadership and management. Yvonne is the human resource business partner at Cayman Fusing. She is responsible for communicating the needs of Cayman to Beata. She will also make sure that the presentation space is safe, allowing for 6 feet social distancing and a surgical mask availability for the staff. The employees at Cayman want to be educated on COVID and how to mitigate its spread between peers. The stakeholders will be the individuals that attend this educational seminar. Interventions to my goal are education and demonstration of hand washing, donning and doffing of face masks, and why social distancing is effective. These interventions will be directed toward the staff at Cayman to help mitigate the transfer of COVID between staff. The educational seminar will take on site of the Cayman facility. These interventions were chosen based on the evidence-based practice of the CDC recommendations. Evaluation. My short-term goal, once the educational seminar is complete, each attending will verbalize back the proper way to wash their hands, don and doff face mask, and why social distancing works. If there is a discrepancy of any return verbal demonstration or physical demonstration, a review of missing elements will be verbalized to the individual. Goal number 2, short term. Once the seminar attendees can correctly verbalize how to perform hand washing, mask don and doffing, and why social distancing is beneficial, there will be a physical return demonstration. A sink with running water, soap, disposable towels, surgical mask will be provided by the facility. If there are any discrepancy in the physical return demonstration, a review of missing elements will be verbalized to the individual as well. My long-term goal will be omitted due to the unavailable of any assessment of not returning to the facility. I did, however, have 4 individuals that needed further education on correct hand washing. This presentation has explained the observable community in Orlando, Florida, and its neighboring cities. The observable area talks about recreational parks, restaurants, and healthcare facilities. There was also an explanation of people that reside in Central Florida. How many people, how much they make annually, and whether or not they are male or female. The health risk was described as heart disease being at the top of the mortality rates in these areas. The community that will be educated is the staff at Cayman. It's a local government contracted business. This education will consist of COVID mitigation techniques such as hand washing, social distancing, and face mask donning and doffing. All participants will be evaluated by observing the return demonstration, with further education will be offered as necessary.